2008, I was diagnosed with COPD, which is chronic obstructive pulmonary disease. I was kind of forced to take a disability pension because I was unable to perform my job duties the way I felt like I needed to do. COPD got worse through the years. I was hospitalized numerous times with pneumonia and was actually on a ventilator a couple of different times. But with the help of my PC doctor, Dr. Teresa Williams at NorthCrest, she addressed a lot of those problems and was able to get me a good pulmonary care doctor who, as a team, they worked together to get me in shape to where I might be able to get on a lung transplant, because they had pretty much exhausted all the means to try to cure my lungs in any way. At some point, I was assigned up to a new program NorthCrest had established for pulmonary rehab. I was the first patient assigned there and was the first patient to graduate. I was able to get my stamina up, and I went from working on machines 2 or 3 minutes at a time to 30 minutes at a time. I lost 75 pounds and 5 inches off my waist. This has given me the opportunity to satisfy the goals needed to get on a transplant list, and that's where I'm at now. And I would like to sincerely thank the staff at NorthCrest. You know, they've saved my life up there. I'm grateful for that.
When I was 12 years old, my dad died of a massive heart attack. To lose your best friend like that, there's not really any words to describe that other than just terrible, awful. So I was very angry, and I was angry at the world, I was angry at myself. It was just, I didn't know how to cope with something like that. And then seeing my mom, of course, was a nightmare. I was living a nightmare. So the following year, after my dad passed away, my mom found out about a camp that NorthCrest Hospital in Springfield puts on, and it's called Camp Tag. And Camp Tag stands for Teaching About Grief, and kids aged about 5 years old to 15 come to this camp, and they learn about how to process their grief, how to cope with it, how to handle something that's so traumatic in their lives. And my younger sister and I went. We learned how to cope with anger and depression and sadness from losing our dad, and through that we really learned how to turn that negativity that had overtaken our lives to something positive, and how to turn it into a positive experience that we're able to help other people, and we're able to turn our lives around from such a negative experience. Camp Tag had such a powerful effect on me that it really influenced my decision to become a counselor at the camp this past summer. That was my driving force to become a counselor. Was I remembered the impact that it had on me as a little girl. When my girls in my cabin found out that I had lost my dad, and a lot of them had lost a parent, our relationship it became so much closer. I mean, it made all the difference when they knew that I had gone through what they were going through, that they did have someone they could come to. And that's what really stuck with me with Camp Tag, was that it's not only about how to cope with the sadness and depression, but also that you're not alone during such a tragedy in your life. And that's how Camp Tag changed me.
My mom was cheerful of life. She had a sense of humor. She loved God. She loved her family more than anything. She was 95 when she had a stroke, perhaps a mini stroke, I don't know, but she started going downhill from there. When they mentioned hospice, the first thing that came to my mind was NorthCrest Hospice, because I had heard such good things over the years. So I had a lot of faith in the people there. Through hospice, we were able to keep my mom at home to her last days, which I don't think would have been possible without that help. They were such a blessing to us and to my mom. She was always treated with respect and dignity. The hospice team was there for us day or night. We just had to call and they would be there. They have also been supportive afterwards. They have sent me information telling me about the grieving process. And when I read it, I thought, okay, I'm not so different after all. This is normal to feel this way. My family just had a wonderful experience with hospice. It was one of the most difficult times of our lives, but hospice made this transition so much easier.
I was really blessed to be raised by a wonderful woman, Martha Parker, who believed strongly in giving back to her community. And one of the things that she talked about as she struggled with cancer the last few years of her life was how much of a difference it made to have support. And she felt real strongly about providing that support to other people. So she helped organize a cancer support group. She would call on people that were recently diagnosed. She would cry with people. She would pray with people. She would just be there for people. And as she battled a recurrence, several of her friends got together and said, you know, we really want to honor you by carrying on this legacy that you have of hope and compassion. And before she passed away, she got to find out about Martha's Song. It's a wonderful program in her honor and now in her memory that raises funds and supports people going through a cancer diagnosis if they live in Robertson County. Financial support helps pay for things in particular that perhaps insurance doesn't cover, things such as wigs or lymphedema sleeves or maybe some nutritional supplements. For some people it's filling the car with gas to get back and forth to treatments, that sort of thing. It really is for whatever need that patient might have, and it provides just a little ray of hope in the middle of all that cancer patients have to deal with. And that's just a wonderful tribute to my mom, and I know that she would be so happy to see that the program's still going on and that every year, you know, hundreds of people hear about it, and every year hundreds of dollars are given away to help people. I remember her saying, it's not about me. She said, you know, it's about the people we can help. And that's just how she thought. And that is what Martha's Song is about. It's about all the people that can be helped, all the people that feel like they have somewhere to turn. And it's really a nice resource for our community that lots of people, unfortunately, have to take advantage of. I think the only thing better than supporting Martha's Song would be one day to not have a need for Martha's Song, and that would be the best.
This happened on December 29th last year. I was having lunch at the golf course at Springfield at Legacy, and a friend of mine asked if I wanted to go out and play 9 holes, and I said, well, sure. So I went out and started playing and developed my chest got real tight, got real short of breath, and something told me I better go to NorthCrest, to the emergency room, immediately. So I did, and when it got to the emergency room, my wife met me over there. The little girl said, don't worry, but you're having a double heart attack. Don't panic. Excuse me. Kind of hard not to panic when somebody tells you you're having a double heart attack. So it was definitely scary. But, you know, it all happened so fast. I was
extremely confident that I was in good hands.
Dr. Russo assured me they had the facilities to get me taken care of, and I had 200% blockages. Dr. Russo put in 2 stents, and fortunately my veins were in good enough condition that the stents held. Didn't have any scars. They barely bruised me. Went in through my leg. It's quite amazing what they can do with today's technologies.
And in my follow-up visits with Dr. Russo, he kind of informed me that I probably only had about 20 or 30 minutes. So having NorthCrest in Springfield was extremely beneficial for me.
It is humbling to thank somebody for saving your life.
Well, I would definitely like to thank everyone at NorthCrest, especially everyone in the emergency department. I'm extremely thankful, because if I'd had to drive to Nashville, I probably wouldn't be here.